Can fluid around the lungs caused by cancer be treated? Absolutely, you've got a few options. As a lung cancer oncologist, it's very common for me to see pleural effusions in my clinic. In the first instance, treatment is all about relieving your symptoms, namely making you feel less short of breath. The medical term you might hear for this is thoracocentesis, but that's just a fancy way of saying sticking a needle between the gaps in the ribs to drain the fluid off. If you haven't got a diagnosis of cancer, it's important that we use that fluid to help make that diagnosis. When they're doing that drainage, make sure you ask that they're sending it off for all the appropriate tests. For a recurring malignant pleural effusion, I think you've got three main treatment options, and often we use a combination of two of them. Firstly, we might insert an indwelling pleural catheter. That's a small plastic tube that you can go home with. Somebody will then come out and drain the fluid every now and again, and that's individual to you how often that needs to happen. For some people, we'll do something called a pleurodesis. That means we'll drain all the fluid off and then do a very minor procedure to make the two layers of the pleura stick together, and that stops the fluid reaccumulating. Ultimately, you need to see somebody like me, a lung cancer specialist, who can treat the underlying cause of the problem. We can use drugs like chemo, immunotherapy, targeted therapies that will shrink the cancer and stop the fluid coming back. What surprises many of my patients and their families is how much better you'll feel within 24 hours of having that fluid drained. The delay in getting to that treatment is often the hardest part for people, living with breathlessness, chest discomfort, difficulty lying down because of breathlessness is not a pleasant symptom. So if you're experiencing delays, explore your options.